This is a recovery room quiz on the topic of the mastectomy. Do you know in what year mastectomies began being performed in the United States? Do you know the difference between a modified radical mastectomy and a total mastectomy? And do you know when the first public picture of a woman with a mastectomy was shown in public? It was scandalous. I'm cancer physical therapy specialist, Dr. Leslie Walke. Join me in the recovery room to learn the answers to these questions and more. Let's get to it. Now, the word mastectomy is a combination of the prefix mast, which is the Greek word for breast, and the suffix ectomy, meaning to surgically remove, which is derived from the Greek word to cut. Now, please note that the correct pronunciation is mastectomy, not mastectomy. The radical mastectomy, which removes all of the breast tissue, the pectoralis major muscle, the pectoralis minor muscle, and most of the lymph nodes from the entire region, was first performed in the United States in 1882 and was heralded at the time as the brilliance of modern surgery. It remained the standard of care in the US until around the 1970s, when then it became considered complete butchery. The radical mastectomy was then replaced by the modified radical mastectomy, which is removal of all the breast tissue and fewer of the lymph nodes from just some areas, but left all the muscles in place. It was in August of 1993 when the New York Times Sunday magazine published this photograph on its cover, entitled "Beauty Out of Damage," and it set off a firestorm of controversy and conversation. Now, moving on to the age of genetic medicine, which resulted in the benefit for some women to have breast surgery to prevent a cancer diagnosis. The prophylactic mastectomy came into play. So there is no cancer, so there is no need for a lymph node biopsy. So a mastectomy that removes all of the breast tissue, but does not remove lymph nodes, is called a simple or total mastectomy. Yes, I know that the words simple and total sound like they mean completely opposite things, but in breast surgery, they mean the same thing. Then in the early 2000s, in an attempt to decrease the side effects from a full lymph node dissection that accompanies the modified radical mastectomy, the main being lymphedema, surgeons began doing sentinel lymph node biopsies where they only remove several lymph nodes. This surgical procedure is called a simple or total mastectomy with a sentinel lymph node biopsy. So, to sum up, nearly all mastectomies done today only remove the breast tissue and do not remove any muscle. If, during the mastectomy, there is no lymph node removal, it is called a simple or total mastectomy. If the surgery is done with a sentinel lymph node biopsy, it's called a simple or total mastectomy with sentinel lymph node biopsy. And if the mastectomy is done with a full axillary dissection, it's named a modified radical mastectomy. And to throw some more terminology on the mastectomy name pile, if surgeons leave behind skin for breast reconstruction, the additional terminology is skin-sparing mastectomy, and it's also possible to have a nipple-sparing mastectomy, again where all of the breast tissue is removed, but the nipple and areola are left behind. So in conclusion, it is possible to have a breast surgery called a skin-sparing but non-nipple-sparing total mastectomy with sentinel lymph node biopsy. Thank you for joining me for this discussion. My goal was to make mastectomy terminology more clear, but if I have completely confused the situation, please ask questions in the comments section below. I'm Dr. Leslie Walke, signing out from the recovery room. Time to take the dog for a walk.